Multiple sclerosis is a chronic, complex autoimmune and neurodegenerative disease of central nervous system, mainly characterized by demyelination with relative axonal preservation. MS is considered the most common cause of neurological disability, and young adults are mainly affected. Whereas the exact etiology and pathogenesis of the disease remains unclear, interaction between genetic, environmental, and lifestyle factors has been incriminated through a cascade of events including activation of both adaptive and innate immune system. Smoking is one of these factors. According to several studies, there is a strong evidence that smoking, active and passive, increases the risk of acquiring MS. This risk seems to be related to smoking intensity and duration with a dose-dependent association. Furthermore, there is strong evidence that smoking worsens MS prognosis and accelerates disease progression and disability accumulation. However, smoking is a preventable risk factor for MS. Interestingly, beneficial effects on its cessation and disability progression have been described in MS patients. The aim of this study is to investigate its effect on the development of MS and the progression of disability through a systemic review of the literature. PubMed database was searched for studies published from 1st January 2009 to 31st December 2018 using the keywords multiple sclerosis, smoking, passive smoking, cigarette, nicotine, risk, progression, and disability. Selection criteria captured only primary adult studies written in English who compared the risk of developing MS, the disease progression, and the associated disability between patients exposed to smoking, active or passive, and non-smokers. The diagnosis of MS was made according to McDonald criteria, and the evaluation of disability was based on EDSS scale. The initial search yielded 641 articles, but only 23 were included in the review after applying the search criteria and after reading the titles, the abstracts, and the whole text. 10 studies showed that smoking is a risk factor for developing MS, with the odds ratio of smokers ranging from 1.49 to 4.2 compared to never smokers. Furthermore, in 7 studies, it was found that the risk of developing MS increases with the number of smoking pack years, thus presenting a dose-dependent association. 2 studies revealed that exposure to passive smoking was a risk factor for MS too, but in another study, this exposure rate did not differ significantly between patients and controls. Concerning the impact of smoking on disease progression and disability accumulation, the results were conflicting. 4 studies showed that smokers had significantly higher EDSS scores as well as significantly faster disability progression compared with non-smokers. However, 4 other studies failed to prove any association between smoking habit and disability progression. Finally, as far as the risk of transforming into a secondary progressive course of MS is concerned, it seems to be higher in smokers. In conclusion, smoking, both active and passive, is a risk factor for MS. Nevertheless, its impact on disease progression requires further investigation. Since smoking is a modifiable health behavior, this investigation becomes increasingly important as its cessation or reduction could be extremely beneficial for MS patients as well as for individuals with positive family history. Thus, public health strategies and interventions against smoking could stand as an effective and reliable tool for improvement in prognosis of MS patients.